I'm Dr. Ilene Serlin. I'm a psychologist and I'm a dance therapist in San Francisco at Union Street Health Associates. And I'm here to talk about working with trauma, especially from the point of view of bringing in the arts, the expressive and the creative arts therapy, so that others may share these wonderful, effective, powerful ways of working with trauma. I've worked with trauma myself, both natural disasters. I was here during the 1989 earthquake, during fires, also though with man-made trauma, working with returned veterans from Iraq and Afghanistan, and abroad in Israel with the Casualty Division of the Israeli Defense Forces and other trauma centers in Israel, where I also saw that they bring in lots of ways of working with the arts and with the body that I would like to share with you now. There's, of course, an increasing and going to be an increasing global need to work with trauma. We're seeing now violence, global warming, uprooting and dislocation of mass numbers of people, and we are being replaced by machines. We're learning about the causes and the numbers related to trauma, but we need to understand, to be effective, we need to understand the human experience of trauma. And while there are many very good efforts to meet this suffering, we need to learn more and be better prepared. So these are creative mind-body approaches. They're cost-effective, they're ancient and age-old, they're client-centered and empowering ways to work with trauma and PTSD. How can they do this? Here are a few main points to keep in mind. Trauma is a crisis of humanity, of mortality, of meaning and identity. It raises the question, particularly for those who have been on either end of unmentionable violence, what does it mean to be human? We need existential, we need humanistic approaches that speak to these concerns. Trauma is in the body. We know, and it's been called, that trauma is speechless terror. We need nonverbal, we need pre-verbal, we need symbolic ways to speak to this level of trauma. We know that trauma is about stuckness, numbness, inability to play. We need approaches that are creative, that are imaginal, where you can begin to imagine other alternatives to where you are stuck. We need dramatic, rhythmic, and emotional approaches. We know that trauma is about fragmentation and dissociation. We need for approaches that connect, that integrate mind, body, various parts of the self, integrative, transitional approaches. We need whole person approaches that can speak to all these levels of mind, body, spirit, and the ecological disasters also. What are some whole person approaches to trauma? We have the creative arts therapies. These are separate organizations that are also one umbrella called the creative arts therapies, but the creative arts therapies were founded as separate organizations. They include art, dance, music, drama, psychodrama, poetry. Each has its own training, its own very rigorous requirements, and its own websites and contact information, which will be provided to you. There's a set of other approaches called expressive arts therapy or multimodal approaches. Since traditional healers also were the shamans of the tribes, and they used combinations of approaches of singing and chanting and ritual. These expressive arts therapies believe that you use all the arts combined, and they also have training, organizations, and certification processes, expressive arts therapies associations. We have body approaches. There is a growing need to look at the role of the body in trauma, where it's often lodged. We have somatic psychology, Qigong, Tai Chi, Aikido, Feldenkrais, movement, EMDR, yoga. All are nonverbal approaches, rhythmic approaches to working with the body. We have spiritual approaches that include mindfulness, meditation, stress reduction, and prayer. What are some of the therapeutic outcomes that have been recorded as benefiting from these approaches? One is healing the mind-body split from dehumanizing terror. Some show creative means for containing, for discharging, and rechanneling aggression and energy. Some show that they strengthen both individual and community resilience and connections. Community trauma, community rebuilding is more known in non-Western cultures where trauma is often a collective experience, and ritual and means that address the community are very important here. These approaches have been shown to decrease compassion fatigue and caregiver burnout, increase family communication and support. They can, being symbolic, bridge multicultural symbolic forms. We need to symbolize traumatic losses and show hopes for the future and establish the connection between the body and the brain. Here are some examples of creative arts approaches to working with trauma that I've been part of. One is called Imagine, Creativity in the Service of Humanity. This was sponsored by Lesley University. It took place in 2006 in Israel, where we had Israeli and Palestinian and Bedouin healthcare professionals and grassroots collaborations talk about their work, about the difficulty of collaboration, but the importance of these grassroots efforts. We had Israeli and Palestinian children singing in choirs together. We saw art therapy being used in the bomb shelters to help children deal with the anxiety of the waiting and the not knowing. There's a group connected to this group called Arts Bridge, which is all about dialogue. Again, it's about giving Israeli and Palestinian youth the opportunity to see each other as human beings and not as objects, and try to reverse some of the trends toward educating the young people toward terrorism. It provides them with tools to make a positive difference in their lives and to have a positive impact on their futures. There are drawings from the Casualty Division of the Israeli Defense Forces. These are 19, 20-year-old young officers from the division for whom some of the losses are the loss of innocence, the loss of childhood. In their drawings, they wrote things like, "Don't worry, be happy," "Calm on the outside, chaos inside. When the mess is inside, it's difficult to see," from one extreme to another, side to side. There was also something there called the Peace Train, which is a music therapist who rides on a peace train. She's Jewish, and she has with her a Zulu dancer. They go through South Africa literally on a train, modeled after Pete Seeger's approach, and all the stops in South Africa where they have people of all races singing and playing music together. Teaching dances, Zulu dances, to Israeli and Arab youth. We have hopes for the future. This is reintegrating at a higher level than what's called pre-morbid condition. That is, the creative arts therapies, because they're creative, we can imagine a higher level of integration besides just going back to normal. People can use or value adversity. There's another theory from England called growth through adversity, where the objective is not just to get back to the normal level, but to actually use the adversity, use the wake-up call to change your life. Creative arts therapies, through the use of imagination and symbol, can do this. Finally, they can deal with compassion fatigue and caregiver burnout. We're now getting a lot of interest, especially through Charles Figley, in secondary trauma, that is the frontline responders and the caregivers who are often suffering, and there's not enough attention paid to helping them. And compassion fatigue, simply running out. So there are researchers here and in Israel and in other places also using the arts to symbolize and create new hope for the caregivers themselves. We hope that you will be interested in the use of the creative arts therapies to work with trauma. It's a growing field, and researches and references will be provided in this documentary. Thank you.